Like if I ask any girl that what type of man you would like, so in India they would say tall, dark, handsome.
Yes. Hi, this is Sharik from Dr. Amar Sarin Limb Lengthening team. Today we have a patient who has done limb lengthening surgery 3 months ago, and today he achieved 8 centimeter. So my first question is, what motivated you to do a limb lengthening surgery?
So I felt that I was short in height and always felt that I am underconfident. So when I look after my peers, they are taller than me. That was giving me an impression of that I am underconfident. So I wanted to grow tall, and I did some research, and I also took some pills. I did, medication, and also did some swimming and all, stretching exercise, but that didn't work. So I did some research, and I found out that the only when your growth plates are stopped, the only thing that can be done is the surgery.
Yes.
So that's why I did this surgery.
So what problem you faced being a short person?
Okay, so my profession, I need to give presentation overseas also sometimes. So I felt underconfident, and it's my perception that when you're tall, people take you seriously, they value you more, and being tall, it's give a good presentation of yourself. So that was the thing.
Okay, so when this kind of thoughts came to your mind that you are short from the childhood or school or the college or especially in the office?
No, when I joined my profession, and like after college, it was not very much, but after I joined my profession, I was in office. So while giving presentation, I used to see all the presenters are taller than me, and in front of them, I feel a bit embarrassed. So that was the point I I felt that if I can grow an inch taller or something more, it would be very beneficial for me.
What was the end point that, okay, your research has been done about limb lengthening surgery and now I have to choose this doctor or this center?
Okay, so when I came across the limb lengthening surgery, I suddenly start searching from the internet that who is the best doctor to do limb lengthening surgery. Even when I was doing some research and some articles, they said that few organizations who do this surgery with the rehabilitation centers. So I have fingertips, I have the institutions who do these surgeries. Dr. Amar Sarin was the best because he has the most experienced doctor in this niche institution and niche surgery. So he was the only doctor I felt that who is the most experienced one, and even I visited few organizations also. So when I came here, it was very free. Like I was given freely to talk to any patients. When I met the doctor, he was very transparent with me. He said all the pros and cons of what would be like the surgery, when there will be pain, how the rehabilitation will work, how many times there will be rehabilitation, as in physiotherapy I'll get, all the things, and that convinced me to do the surgery by Amar Sarin. And when I came here, I got to know that I'll get 3 physiotherapies, which is very rare, because I also went other organizations also, they only provide 1 or 2 physiotherapies. But here I'll get 3 physiotherapies over the day. So that was my motivating point that yes, I am in a good hand. I see many patients who had a frame, and also the few patients who are walking.
Something about our physiotherapy rehabilitation facility.
Okay, so firstly, your Dr. Amar Sarin has more than 30 years of experience. Apart from that, even yourself, you also have like 15 years of experience, more than 15 years of experience. And the team under your guidance, they are very good, very skilled. So even from the day one, I am seeing that it's not that I was not in pain. Like sometimes I had a back pain also. So they also cured that. When I felt any pain, they cured that. So yes, you have a very good and skilled physiotherapist over here.
Tell us about your 3-month journey.
Okay, I would like to start from the day 1 when I was in hospital. The first few days, like first 10 to 20 days was painful because lengthening was started and I was not habitual to the lengthening. So I was a bit painful. But the finest thing was the other peers and the patients. They were so friendly. I got friends for life. Like when I came here, after a few days, I interacted with other patients also, and I felt like a college reunion. Because what happened in my room, when I was not able to move, every patient used to come and sit into my room, and we used to chit chat for like 2-3 p.m. night, or as in sorry, a.m. night, we used to eat together. Then we used to chill together. Mostly we used to watch movies and used to play some games, video games. So that was, really fun. I would definitely miss these friends and the journey. And apart from, today I have completed 90 days. Today is my 90 days. And I got around 8.3 centimeters in both my legs. Last 20 days last 10 days were a bit painful. Not painful, I would say discomfort.
Yeah, after 7 centimeter, because your muscle get little bit tighter and you are somehow you are tired of being all the time on the bed. So it makes you a little bit discomfort. Till 7 centimeter is okay, but after 7 to 8 is kind of little bit hard.
Yes, and that point of time I really felt that how much physiotherapy is needed. Today I have completed 8.3 centimeters. It felt a sort of achievement for me.
Yes,
and
it is a big achievement, 8.3.
Yes, and the credit is not only for me, but the credit also shares to the physiotherapist who did the physiotherapy and always tried their best to provide how can I get relief.
Yeah. So your target is 8.5 centimeter.
Yes.
Initially your target was around 7 centimeter.
Yes.
When you see that, okay, I can go 8 centimeter, your muscle stiffness is okay, it's not that much tight, and bone formation is good, so you decide to go for 8.5.
Yes, so I was in a panic with, I saw the videos, 7 is very hard to achieve, but I met other patients also and I saw here everyone is doing it.
Yeah.
Like most of the patients do 8 centimeters very easily. Even I crossed 8 centimeters, I won't say that there was pain, but a bit of discomfort, and today I have achieved 8.3. Throughout the journey, the only pain I felt was the 10 days, and the rest was a bit of discomfort, more or less that was discomfort, and that was manageable by the medication provided by you.
And you have a neighbor room where he did the 8.5 centimeter.
Yes. He was in front of me only.
Yeah.
He did 8.5. That was the motivation for me only.
So your journey overall was very smooth.
Yes, I would say the journey was very much smooth. The physiotherapists were good, but the foremost thing is the friends that I got. They led the journey very smoothly.
So how is the environment here?
Very friendly, very friendly. I told you that I would miss this place. I won't miss this place, but I would definitely miss the friends that I made here.
It's look like home?
Yes, it was like college reunion. That I was in hostel days. I felt like this is the hostel days.
Yeah, that's good.
Yes.
This is good for the mental peace and all, yeah.
Definitely. I was not homesick. I was far from home, but I didn't feel like homesick.
My final question is what would you like to add for the future patient?
Okay, I would suggest that whenever you are going for limb lengthening surgery, it's a very niche type of surgery. So always choose the doctor very wisely and always visit the rehabilitation center.
And first priority is your doctor.
Yeah, definitely. I have seen patients who was they came from other organization and did some mistakes and you were curing them. So I did some of the patients and that was horrible. So yes, choosing a doctor is very foremost thing.
Yeah, because main is doctor. If surgery went wrong, physiotherapy or other method cannot be recorrected.
Yes, that can be revised.
Surgery gone wrong. So the best thing is that you choose a good doctor, experienced doctor. This is the first priority for every patient.
Yes, and Amar Sarin sir is the only doctor who is dedicated to this surgery.
Yes, correct.
Yes, I haven't seen any doctors or any orthopedic who only do limb lengthening surgery. There are doctors who do a vast orthopedic surgeries.
Correct. Your initial height and what is your final height now, because you almost done?
Yes, my initial height was 162 something and I have achieved around more than 170 centimeters.
You happy now?
I am very much happy. This is an achievement for me.
Thank you, sir.
Welcome, sir.